Hello everyone. Today our topic of presentation will be about the anatomy of urinary bladder. I am Dr. Junaid, MD. Uh, Today we will discuss about the anatomy of urinary bladder. First of all, we will start from the introduction. The urinary bladder is a hollow muscular organ that stores urine temporarily before maturation. In adults, it usually holds around 300 to 500 milliliters of urine. It is located in the pelvic cavity just behind the pubic symphysis. External features of the urinary bladder. The bladder has four main parts: the apex pointing forward, the base or fundus directed backward, the body forming the main portion, and the neck, which is the most inferior part, continuous with the urethra. As this picture is showing the external features of the urinary bladder, as you can clearly see, there is the bladder wall which contains the detrusor muscle. Above the bladder there is peritoneum, and on the lateral sides both ureters are entering the bladder and terminating at their openings in the bladder, which are known as ureteric orifice. Then there is a bladder neck where urethra is ending, bladder neck is starting. Then part of the bladder is called the trigone. This picture is also showing the gross anatomy or gross features of the urinary bladder, like both ureters entering behind the bladder and their opening on the lateral side of the bladder at interureteric ridge. Then bladder is surrounded by the detrusor muscle, which is a smooth muscle. Then there is internal urethral sphincter located at the bladder neck. Then you can see the external urethral sphincter, which is composed of skeletal muscle, which is present at the behind the verumontanum. This picture is depicting the external features of the bladder as well. Like there is above there is apex, below there is base, and there is the neck of the bladder. Then there is inferolateral surface, superior surface, and median umbilical ligament connecting with the apex of the bladder. Then we will start about the surfaces of the bladder. The bladder has three main surfaces. The superior surface of the bladder is covered by the peritoneum. The inferolateral surfaces are related to the pelvic floor muscles, and the posterior surface lies against pelvic structures such as the rectum in males and vagina in females. As this picture is showing the superior surface of the bladder, which is covered by the peritoneum. Inferolateral surface lies against the pelvic structures like rectum in males and vagina in females, and the posterior, and there is inferolateral surface related to the pelvic floor muscles, and posterior surface is lying against the pelvic structures. Then we will study about the relations of the bladders. Relations of bladder with the different structures in males. In males, the bladder is related superiorly to the coils of the small intestine and sigmoid colon, posteriorly to the seminal vesicles and rectum, and inferiorly to the prostate gland, and anteriorly to the pubic symphysis. This picture is clearly showing the relation of the bladder. Like bladder is here, bladder is related superiorly to the coils of the small intestine and sigmoid colon, and posteriorly to the seminal vesicles and the rectum, and inferiorly to the prostate gland, and anteriorly to the pubic symphysis. Then we will move to the relations of the bladder in females. In females, the urinary bladder lies inferior to the uterus and anterior to the vagina and cervix. The pelvic diaphragm supports it inferiorly, while the anterior relation is the pubic symphysis, similar to the males. This picture is clearly showing the relations of the bladder in females to the various structures, like as here you can see that bladder in female is lying inferiorly to the uterus and anterior to the vagina and cervix, and pelvic diaphragm supporting it inferiorly, and anterior relation is the pubic symphysis, which is similar to the males. Then we will study about the internal features of the urinary bladder. On opening of the bladder, the most important feature is the trigone, which is a smooth triangular area at the base bounded by the two ureteric orifices and the internal urethral orifice. The rest of the mucosa is folded except when the bladder is distended. The muscular cord, which is called the detrusor muscle, plays a key role in micturition. And this picture is clearly showing the internal structures of the bladder. Here you can see the trigone of the bladder, which is a smooth triangular area. Then you can see the both ureteric orifice, where right and left ureters are opening on right and left side. Then you can see the mucosa on which bladder is folded, except when it is distended. And here you can see the detrusor muscle, detrusor smooth muscle, which plays important role in micturition. Then we will study about the blood supply of the urinary bladder. The urinary bladder receives blood mainly from the superior and inferior vesical arteries, both branches of the internal iliac artery. In females, the vaginal artery also contributes. Venous drainage occurs via the vesical venous plexus into the internal iliac vein. This picture is clearly showing the blood supply of urinary bladder. Here superior and inferior vesical arteries branching from the internal iliac artery supplying the bladder, and in females vaginal arteries contributing, while and venous drainage is shown in next. Here you can see the venous drainage. Here is prostatic venous plexus, then there is vesical venous plexus, and ultimately they are draining into the internal iliac vein, which is further draining into the inferior vena cava. Then we will study about the nerve supply of the urinary bladder. The urinary bladder is richly innervated. Sympathetic fibers from the hypogastric plexus relax the detrusor and contract the sphincter. Parasympathetic fibers from the pelvic subclavian nerves cause contraction of the detrusor muscle and relaxation of the sphincter, aiding in urination. Somatic innervation from the pudendal nerve provides voluntary control over the external urethral sphincter. This picture is showing the nerve supply of the urinary bladder. Here you can see that sympathetic fibers originating from the hypogastric plexus, which cause relaxation of detrusor and contraction of the sphincter, while you can see the parasympathetic fibers from the pelvic subclavian nerves, which are causing the contraction of the detrusor and relaxation of the sphincter. And you can also see the somatic innervation from S2, S3, S4 segment supplied by the pudendal nerve, which provides voluntary control over the external urethral sphincter. Then we will talk about the lymphatic drainage of the urinary bladder. Lymph from the bladder drains primarily into the external iliac lymph nodes, internal iliac lymph nodes, and sacral lymph nodes. This has clinical significance in the spread of the bladder carcinoma. This picture is showing the lymphatic drainage. Here you can see that lymphatic fluid from the bladder is draining into the external iliac, then internal iliac, then sacral lymph nodes. Multiple lymph nodes present in presacral area, and these external iliac and these internal iliac lymph nodes are further draining into the right paracaval lymph nodes and left para-aortic lymph nodes. Histology of the urinary bladder. Histologically, the bladder is lined by the transitional epithelium, also known as urothelium. Beneath it lies the connective tissue, followed by the muscularis layer consisting of the detrusor muscle. The superior surface of the bladder is covered by the peritoneum. This picture is showing the urinary bladder histology. Here you can see the transitional epithelium, then you can see the connective tissue, followed by the muscularis layer, and superior surface of bladder is covered by the peritoneum. This picture is also showing the histologic features of the urinary bladder. Then lastly, applied anatomy. Certain conditions are applied to the urinary bladder when bladder get diseased. Like applied anatomy includes several clinical conditions such as cystitis, which is known as the inflammation of urinary bladder, or bladder stones, urinary retention, and incontinence. Incontinence means loss of urinary control, and the bladder carcinoma. Suprapubic cystostomy is a surgical procedure where a catheter is introduced into the bladder through the suprapubic approach through the anterior abdominal wall, which is done in acute urinary retention. So to summarize, we have discussed the anatomy of the urinary bladder, including its location, external and internal features, blood and nerve supply, histology, and important clinical aspects. Thank you very much for listening to my lecture. For any query, you can contact me on my WhatsApp number given here. Thank you very much.